Hello, Carbon County. Thank you for joining us for today's Facebook Live featuring physical therapy in the Valley. We are here at the MHCC Health Center, Platte Valley, in the physical therapy area with Fremont therapy groups Nate Tanner, Skyler Jorgensen, and Austin Hunt, who will be presenting our topic today. Questions from viewers are welcome, and we will address those at the end of the presentation. With that, Nate, we'll go ahead and let you start.
Hello, my name is Nate Tanner. I'm a partner in Fremont Therapy Group, and we have recently, well, in the past year or so, we've created a relationship with Memorial Hospital of Carbon County to offer therapy services throughout the county. One of our locations is now here in Saratoga at the new facility that was constructed by the hospital. So we're excited to be here in Saratoga offering physical therapy services. Just a little bit more about myself. I live in Rawlins, and I've been there for about 11 years now. I'm a Wyoming native and have been raising my family in Rawlins. I love Carbon County and just enjoy living here and all the things that Carbon County has to offer. A little bit more about myself. I have a bunch of kids that keep me really busy. So whenever I'm not working as a physical therapist, I'm just messing around chasing them. So they like to do sports and we like to do things outdoors. So that's pretty much what I spend all my spare time doing. I think that's probably enough about me for now. I'll let my two coworkers introduce themselves, and then we'll talk a little bit more about what we do here in Platte Valley.
Yeah, so I'm Skyler. I've been a physical therapist for a little over 2 years now, since I graduated school. And I've been here in Rawlins since I graduated, so it's been an excellent place to start my career. And so I'm originally from Utah, and then I went to school in Nebraska, graduated from there, and moved straight to Rawlins. So it's been awesome working with Nate and our other co-workers up in Rawlins, and then transitioning to some days down here has been really good too. So it's been excellent.
And I'm Austin. I'm the newest to the Fremont group. I just joined them in August when I graduated from Missouri State in May. So I'm a new PT, but I am very excited to be here. And I live in Elk Mountain actually. We're on my grandparents' ranch, where I grew up in the summers, so I'm really familiar with the Carbon County area. And I say I'm pretty much from here because, like I said, in the summers I grew up here and love the area, and I'm looking forward to starting my career here, and I really have enjoyed it so far.
Okay, so a couple of things that we wanted to just address today. We'll discuss. We want to educate the people of the Platte Valley specifically about the services that we have to offer and what we do as physical therapists, because not everybody knows all the things that we can do as therapists. So I wanted to highlight a couple of things that we've been doing. One of the main things that I want to talk about today is dry needling. That's a service that we offer, or one of the treatments that we offer as physical therapists. And just recently, three more of our therapists have become certified as dry needlers. I myself have been doing it for a couple years now, and then just recently, Skyler, Wojtek, and Katie Adams, one of our other therapists, have all also been certified as dry needlers. So it's a great treatment. It's one of the tools that we use to help people to recover from a lot of chronic conditions. It also helps in acute conditions. It's basically a treatment used to treat muscle dysfunction. So it's very useful and as used as a adjunct to manual therapy. So when you have those trigger points, those tight muscles that are causing you pain, we use needles often in conjunction with electrical stimulation to help get a release on those muscles and provide relief, decrease pain, increase range of motion of joints in the area, and just improve function in general. So it's a unique treatment that I think is not well known or seen a lot around, but we've seen great results from it, and it's one of the things we really like to do. We've seen a lot of benefit from the patients that we've been using it on up to this point. So we're excited we have several more practitioners that are able to provide that treatment now, because it's been just a really good, we've had a lot of good results from it. I'll let Skyler and Austin address a couple other, and we'll just keep going through some of the other things that we can do as therapists, and then if there's questions along the way, we'll stop and address those. So.
Yeah, so I think the biggest thing that I kind of wanted to talk about today was if you have any types of conditions where you are having trouble getting back to the physical activities that you love, or you are having problems with specific muscles, joints, or anything like that, feel free to come in and talk to us. We do have 15-minute free consultations that we give to people. And if you're not sure that physical therapy is right for you, that's an excellent opportunity for us to just have a conversation and look at some stuff, because there's a lot of things that we can treat, and we could spend probably a good 2 or 3 hours talking about every single thing. But even just, I've had patients in the past come to me and say, I feel kind of stupid that I'm here because it's so inconsequential. And I always tell them, as long as we're increasing your ability to perform the things you love to do, I don't think that that's inconsequential. I feel like there's lots of things that we can help that may seem small, but if it helps you and we can get you to a point where you're having less pain or having more function, that's something that I really try to work on with all of my clients, but then also just increasing people's ability to get back to doing the things they love: hunting, fishing, hiking, all the stuff that we love to do here in Wyoming. I love to do that stuff too. So it's something that don't ever feel like it's too small to come see us, because even if we just give you some exercises and send you back to your gym or whatever you're doing on the outside, then that's something that I think that we would love to do.
I just wanted to build off that before Austin goes. Sorry, Austin,
Good.
not to cut you off, but I just love what Skyler's talking about, because it's true. We as physical therapists, we kind of consider ourselves as movement experts. We take we do continuing education courses every year, every other year. We have to re-up our licenses with those type of things. We're constantly looking at the mechanics of movement. In our schooling, and these guys can attest, they're just recently out of school, we do extensive study on the musculoskeletal system, and we consider ourselves somewhat experts in that area. We can address any type of dysfunction that is going on with the musculoskeletal system. Like Skyler said, any type of movement, anything you're having a problem with, and that's what we love about physical therapy, is the fact that we get to help people get back to doing what they want to do. Like Skyler said, that's our complete goal, is to help people have a more healthy, active lifestyle, and we love it when we get to see people achieve those things and get back to doing what they want to do. So, like Skyler said, we can address pretty much any sort of movement dysfunction. Skyler himself has actually taken extensive training in assessing movements and creating different programs to help address those dysfunctional movements. So it's an area that we're passionate about, and we just love to do that. So.
And that's definitely something I forgot. So the CPS behind my name, that's exactly what Nate was just talking about, was functional movement screen, right? So it's definitely something that I forget that I can offer specifically, right? But I use it every day when I assess patients and when I'm assessing their functional movements, and it's definitely something that I need to be better at just marketing, straight for that. So if you feel like you're having trouble with squatting or lunges or reaching or anything like that, I can do a specific assessment of those movements, and we can figure out different strategies and exercises and stretches that we can do to really focus on those aspects and get you back to doing full squats or doing getting back to all the stuff you do at the gym without pain. So that's something else that.
I want to talk about some other specific areas that a lot of people don't know that we treat. A couple of those are including like vestibular things, meaning like dizziness or vertigo, we can help with that. And those are things that a lot of people don't think that we can help with, which is really cool. And then some other things are falls. You know, right now with winter coming up and stuff, there's going to be a lot of ice, and falling isn't necessarily always a normal thing. It should not be a normal thing. And there's things that we can do for you guys to help prevent any falls and prevent any fractures or anything in the future. And another area that I have a little bit of experience in, and I would love to expand and will get to expand, is pelvic floor physical therapy. This is an area such as incontinence, both fecal and urinary, that there's things that we can do because that's a whole muscle group underneath there. And there's exercises and relaxation techniques that we can use in order to improve your function in that way as well.
I think along those lines, just another thing building off of that, we actually recently, there's a campaign going on through the APT, or our National Association, about preventing falls, and so that is a key thing that we work on with people, even people that maybe have not fallen but have had a surgery and things are just not the same as they were before. They can benefit from those type of training regimens that we do, working on balance and proprioception, the ability to know where you are in space, and we can help prevent those falls. Along those same lines, we have extensive training in looking at people's gait, the way that you walk. You know, sometimes you have some sort of dysfunction. Maybe you got a sore ankle, a sore hip, or you've had an injury there in the past, and it's changing the way you're walking, and then you're limping, and that's causing pain in another area. Well, those are things that we can definitely address as well, helping you to get back, because we as humans, that's how we get around. We need to be able to walk and move, and so if we can pinpoint what the dysfunction is and then isolate those areas and address them, then we're able to improve your ability to walk and get around, and like we've said up to this point, enjoy Wyoming and your daily life and all the things that we want to do as we live.
Something just popped into my head, you know, sometimes we wait too long to get treatment for things, right?
Yeah.
So, especially with falling, there's 3 simple questions that we're trying to ask everyone that comes into us, and we've gone around to all of the physicians in the area and kind of, you know, asked them to also start to ask these questions of their patients. So if you've fallen in the past year, if you have a fear of falling, or if you feel like you're weak or unstable, right? So if you answer yes to any of those 3 questions, we want to get you in, especially the last 2. If you're afraid that you're going to fall, or if you're feeling unsteady or unstable, we can do a lot of things prior to a fall event that will help you not to fall, right? So that's definitely something that we want to really expand and really get more individuals into the clinic before a fall event, to where, you know, we're not working back up, we're just really trying to ensure that you're as strong as you possibly can before a fall, and God forbid any fracture or anything like that, because then that makes that whole process that much harder. Now we do treat all that stuff too, so it's just, we would like to move more into a preventative space and help people not to experience those falls and those injuries.
I'm sorry, go ahead. Do you offer services to patients of all ages?
Yeah, we see patients from birth to 120 or however old we can get as humans. So there is no restriction. In fact, as far as pediatrics, I myself have extensive experience working with kids from infant to high school age. We have Austin also has done some of that. One of our PTAs, Morgan, also has a lot of experience with working with children. We also employ an athletic trainer at our facility in Rollins, and we can use him as a resource as well in the Platte Valley. He has obviously, that's his area. He works with high school athletes and has a ton of experience, and he's been, we got 4 years. Has he been an athletic trainer for 4 years or so?
Sounds about right.
So he's got about 3 to 4 years of experience in the schools working with high school athletes as well. So another resource there, but definitely all the way up into adults and geriatrics. We have some of our clinicians have extra experience also with the geriatric population. So yeah, any age doesn't matter.
So can you expand on some of the different conditions that you treat? I know you've touched on that somewhat, but can you specifically here in the Saratoga facility, maybe some of the differences between this facility versus the Rollins facility?
I would say there's not a lot of differentiation as far as conditions we can treat here as opposed to in Rollins. I mean, anything that we can treat in Rollins, we can treat here for the most part. We might not have all the same tools because our facility in Rollins is a little bit bigger. One notable difference is there we do have an aquatic facility where we can do aquatic therapy. And actually right now we have some patients that might do a day here and might go up to Rollins to be able to take advantage of that facility as well. So, and that's a nice thing that we can offer those that want to drive a little bit. We can still use that as a resource. Any other conditions I think we can pretty much treat across the board. One that I feel like we maybe haven't addressed as much is we do a lot of orthopedic care, so bones and joints, that type of thing, post-operative care, and we can do that in both locations. One area that we maybe haven't talked about as much is neurological conditions, so people that have had a stroke or a brain injury or some other sort of neurological injury, we do a lot of rehabilitation with those individuals as well. Another area is after a cardiac event. We can't do what they call cardiac rehab because that does require a staff cardiologist, but we do what is called reconditioning a lot of times, which is building people back up to that level of endurance, of functional endurance following like a heart attack or some other cardiac event, cardiac surgery, those type of things. So individuals that have those issues, we have training, we know how to monitor your vitals and make sure that the exercise dosage is appropriate to safely get you back to a prior level of endurance where you can, again, get back to enjoying your normal life. Any other ones you guys can think of?
On those same lines, I mean, in the day and times we live in with COVID, we've seen a lot of good things come out of treatment with our post-COVID patients. So if you're having trouble, or if there's problems after you've recovered and you're still having some endurance or some breathing or strength issues, definitely come in and take advantage of a consultation or talk to your physician about it and see if that's something that they would prescribe for you. Because I've had a couple, and I know we've had more than just a couple of patients come in with post-COVID, and what we provide is just a gradual return to hopefully daily functions. So it's just something that, I mean, with the world we live in, it's becoming more important to get back to normal daily life, and we can help do that.
I think that's another area where people probably maybe don't think of us first when you think of that, but yeah, that respiratory endurance, we know how to do breathing exercises and proper exercise dosage in order to gradually build you up safely to where you can get back to where you should be following something like that, post-COVID and stuff. So we've had several really good success stories of people that have come in coming out of the hospital from having COVID. So it's been pretty cool, kind of a newer area that we've delved into. It's always been part of our practice, but something that's kind of had a new twist with where we're at now. So.
See, so the three of you, are you the only therapist that provide services in the Platte Valley clinic, or do we have other therapists coming over from the Rollins location?
Currently, we are the three that are handling this clinic. Yeah. So right now, Austin is actually here 3 days a week. She comes down half a day on Mondays, Tuesdays, and Thursdays, and then Skyler and I trade off on the other days we're here. I'm here all day Tuesday, and he's here all day Thursday. So right now, we're the ones kind of manning this clinic.
Is there a referral process to have an appointment scheduled with you? Do you require a physician referral?
We do not. Wyoming is what they call a direct access state, so you can come see a physical therapist without a referral. There is a catch to that. Some insurances require a physician's referral in order to cover physical therapy services, so you need to be cognizant of what your insurance covers. But as far as if you kind of just like if you wanted to go to the chiropractor and you wanted to pay out of pocket, you can access us that way without a physician's referral. Yeah, sometimes insurance for insurance coverage, sometimes you do need a physician's referral. So it just depends on what your insurance is.
And do you accept all insurance companies, or is that limited?
Yeah, we accept pretty much everything. Even if it's something new, we'll work to get a contract with your insurance company, but there's very few that I don't really know of any off the top of my head that we do not accept.
Let's see, is there any other specialties or any other services that you'd like to expand on?
That's pretty good. We've summed up most everything.
Okay, great. Well, at this time, it does not look like we've had any questions come through from viewers, so we will continue to leave this open, though, and if questions do come through, we've passed those on to you, and so that we're able to ensure that we're answering those patient questions accurately and timely. And so we just would like to thank everyone for joining us. Are there any closing thoughts from the group?
Just like I said at the beginning, we're just super excited to be in the Platte Valley. I think we've had lots of patients that have made the drive over to us over the years. Like I said, I've been in Rollins for 11 years now, and there's just been so many people that have driven over there to receive our services. And it's just nice to finally be able to come, and thanks to the hospital that they built this facility, that we can finally be here so that we can hopefully serve more people in the Platte Valley, because maybe that was something that deterred them before having to drive all the way over there. So hopefully we can see more people and help more people here in the valley to see what physical therapy can do to benefit your lives.
Absolutely. All right. Well, again, thank you for joining us this evening, and we look forward to any questions that you may have. Thank you, everyone, and have a great evening.